Hello, everyone, and welcome to our 19th lecture in our course on brain and behavior. In this lecture, we will cover emotions. And emotions are a difficult topic in psychology and certainly in brain and behavior because, as we'll see, a lot of emotional experience is hard to access, hard to describe. It's subjective. In fact, that's a core component of what an emotion is that it feels a certain way, and it's hard to describe how emotions feel without referring to other feelings. There's a certain quality to emotion that is difficult to measure, that's inherently subjective. That being said, we know a fair amount about how emotions work, even if we don't know theoretically how to categorize them, how to measure the subjective components. So what we're going to do is look at mainly emotions today. We'll also spend a little time looking at particular uh, concepts related to emotion, like aggression, like stress. And we'll see that when it comes to emotion, cause and effect is a little hard to determine. So we, in our sort of folk psychology, think of emotions as something we experience, and then those produce behavior, produce physiological effects. We're going to see some data that calls that into question. And emotion detection. So emotions aren't just internal. We also have behavioral ways of expressing emotion, certain actions, facial expressions. So we'll talk about how we detect emotions and why. When it comes to other people, emotions are a very important topic. So many emotions are socially based. It's hard to feel embarrassed when we're by ourselves. It's hard to feel angry when we're alone. And some emotions we might feel by ourselves, but other people are directly involved in a lot of our emotional experience and also interpreting their behavior. How do we respond to what other people are doing? And that's part of our unit on aggression. And we'll talk about stress. And stress obviously has a negative connotation. No one wants stress in their lives. We all try to reduce stress. But we all have the idea of stress. We all respond to stress. And there are certain characteristic ways that people respond to stressful events. People vary from one to another, but a lot of that response is fairly well characterized. So the question is, why do we have a stress response? Wouldn't it be great if we just didn't respond to stressful events differently than anything else in our lives? Wouldn't our lives be better? And we'll see the answer, maybe no. So again, emotions lack that simple cause and effect relationship that we usually think of them as having. We have some stimulus, something that makes us mad, for example, and we think of that emotion as being the trigger for behaviors. Maybe they're aggressive behaviors in the case of anger. For physiological changes, we get mad and then our heart races. We'll see it's not so simple. We'll also see that we are pretty good, though not perfect, at detecting emotional expressions in others. We're also pretty good, but not perfect, at detecting our own emotions. We've already seen above that we don't even really have accurate access to which things are the causes and which things are the effects for emotions. So we're not perfect at detecting this, but we have some accuracy. As always, we'll talk about the brain. How are emotions detected by the brain? How are they caused by the brain? What's the relationship between the brain, for example, and physiology when it comes to emotion? And we'll see that stress, again, we usually think of it as having a negative impact on our lives, but there are some positives. So we'll go over that as so first and foremost, what is an emotion? We talk about emotions, we talk about feelings, but again, they are hard to describe uh, without referring to other feelings. You might say you feel angry. Well, what does that mean? Well, it means I feel aggressive or I feel unhappy with somebody else. Um, I feel that an injustice has been done. Those are all feelings. And so it's hard to describe the process of an emotion without just sort of pawning it off on other emotions. So emotions involve a subjective mental state. They feel a certain way. And that feeling is hard to express to someone else. It's hard to convey. Now, we all know what someone means when they say they feel angry because we've experienced anger as well. But imagine if you were some sort of objective third party, if you were a robot or an alien species that didn't have the concept of anger. How would you relate to that individual, and how would you convey to them what anger meant? A lot of it is subjective. It just feels a certain way. It also carries with it distinctive behaviors, and these are easier to describe. So in the case of something like sadness, we feel sad, and that feeling is hard to convey, but there are also distinctive behaviors. We might seek the comfort of a friend. We might have distinctive responses like crying or sobbing. So those behaviors are a little easier to describe, but they're also characteristic of the emotion. And then you have these involuntary physiological changes. When you are afraid, you have distinctive behaviors like your eyes getting wider, but you also have involuntary physiological changes. Your fight or flight system kicks in. Your heart races, your breathing increases, your pupils dilate. And these are not things you usually have control over. They are involuntary and physiological. So we've talked about anger, we've talked about sadness and fear. Sort of my go-to example is the Incredible Hulk, which we see here. And the Hulk is sort of, if you're familiar with the Marvel movies, is an exaggeration of what emotions do, but there is a kernel of truth here. So certainly the Incredible Hulk changes physiologically. Obviously he changes physically from a human being into this sort of big monster-like creature. Doesn't have any control over it. The involuntary part is a very big part of what the Hulk is. And so physically changing, now we don't physically transform into a different looking person, but things like the fast heart rate, the heavy breathing, these are involuntary and they are physiological. Distinctive behaviors, in this case, the Hulk is characterized by anger. And so aggressive behavior is part of our typical anger response, and it's certainly part of the Hulk's anger response. But also that subjective mental state when the Hulk gets angry. And while we can relate to what the Hulk is feeling, it's still very hard to describe what exactly that feeling is without just referring to other feelings. And that brings us to ideas of how emotions work. We've already talked a little bit about this. We have our folk psychology notion that we have some external stimulus, something happens out in the world. And of course that goes through our senses. We perceive what the event is. And then we have an emotional experience after processing the event. In this case, if a loud noise happens, we might suddenly have a fear response. And then our emotions are what produces the physiological changes, the increase in heart rate, for example. And that makes a certain intuitive sense, but there's also evidence to suggest it's not right. So, as we'll see, we can have emotional responses and physiological changes before we even have the full feeling of fear. And so this order may not quite be right. Along come a couple of psychologists named James and Lange. This is William James, one of the most famous psychologists in history. And it looks like Lang, but it's pronounced Lange. And they reversed two of the steps here. They said that the stimulus has to be perceived, obviously, has to go through the senses, but then actually the physiological changes happen first. Your heart races, your pupils dilate, your breathing rate increases, and that it's your brain's interpretation of that physiology that leads to the emotion. So in other words, it's the opposite of our usual idea that our feeling produces the physiological change. Here, the physiological change happens first, and then that leads to the feeling. Now, there are a couple problems here right off the bat. First is that means that for every feeling, you would have to have a specific pattern of physiological change, that every emotion would have a pattern of physiological changes. Your heart rate would change this much. Your breathing would change like this. Your pupils would dilate this much. And the fact is there just aren't enough different physiological states to really account for the wide range of emotions we experience. The other problem is that physiological changes indeed sometimes do happen after emotions. If you think about being embarrassed, one of the most common physiological changes is what we call blushing. Blood rushes to your face, but that takes a while. You almost certainly feel the emotion of embarrassment before the physiological change is apparent. So James Longa is, in its pure form, is not correct either. There's what's called the Cannon-Bard theory, which is the idea that these two things are separate. They are parallel. You have physiological changes like heart rate, and you have emotional experiences that are subjective, but that they are independent of one another. One could happen before the other, or vice versa, and it sort of doesn't matter in the Cannon-Bard theory. This is their way of sort of having their cake and eating it too, that it doesn't specify a particular order, because some emotional experiences, the physiology happens first. In others, the emotional experience happens first, that subjective state. So Cannon-Bard put forth that these are independent. This isn't quite right either. We'll see why it's not quite right here in a moment. But first, we'll talk about different theories of emotion in terms of categories of emotion. There are what are called categorical theories, ways of organizing our emotional experience. And these posit usually that there are sometimes 6, sometimes 7, sometimes 8 basic emotions. And if you've seen the movie Inside Out, this is what that movie is based on, the idea that you have a handful of really basic emotions that are separate entities. And if you've seen this movie, I recommend that you do. Its take on how memory works is a little bit off, but the emotional theory is both entertaining and fairly valid psychologically. But every emotion in this movie is represented by a different character. And that's what the categorical theory really says, is that these are separate entities. They actually come into conflict with one another, both in theory and in the movie. So that sort of one is in charge at any given time. And if a stimulus comes in that provokes a different emotion, that emotion literally has to vie for control via this control panel over what the person feels and what they do. So that's the idea of categorical theories. They can vary in intensity, as you see in this diagram from your book. Mild anger would be annoyance, serious anger would be rage. But that the idea is still that these are independent entities, and that you can only really feel one at a given time, and they compete. And this is for basic emotions. Basic emotions are, as you might expect, the things we refer to most often. Happiness, sadness, anger, disgust, surprise. There are also complex emotions like pride or envy or jealousy. And these are often more socially based, but often don't fall into just one of these categories. They might combine them. And so complex emotions are even harder to research, especially because they tend to vary more with culture. Different cultures will have different words and different concepts for these complex emotions. They may combine basic emotions in different ways and refer to new emotions that, for example, we don't have in Western culture or in English. So there's some cultural basis there. But the basic emotions, as we'll see, tend to be fairly universal. Not entirely, but fairly universal. Another kind of theory that your book doesn't really go into are the dimensional theories. And so here, the idea here is not that every feeling is its own entity, that they compete and are otherwise unrelated. The idea here is that emotions all exist on a spectrum, technically 2 spectra, that emotions are united in that they both entail some degree of arousal, that is a physiological state, that you're either activated or deactivated, and valence, what you might call pleasantness. So, for example, if you were excited, if that is the emotion you were feeling, you could describe that as high arousal, that is you were activated, but also pleasant valence. Being excited is a good thing. It feels good. Whereas being something like relaxed is pleasant, but you're deactivated, low arousal. Something like anger would be high arousal, you're physiologically active, but also unpleasant, so low or negative valence. You could also be bored, which is unpleasant, but also not very active. So you can describe any emotion on these two dimensions of arousal and valence or pleasantness. So that's the idea there. And that's really all we're going to say about that for now, because a lot of emotion research deals with the more categorical theory. Okay, so we have all these theories of emotions, what emotions are, how we should organize them, and also whether they are causes or effects. And this is where empirical data can really be helpful. So after the folk psychology, James Lange, and Cannon-Bard theories came the Schachter-Singer theory. And this theory came about because of experimental evidence. And they were interested, these two psychologists, Schachter and Singer, were interested in this role of physiological arousal. So in our folk psychology theory, our emotional experience causes physiological arousal. Under James Lange, it is the consequence of physiological arousal. And in Cannon-Bard, they're completely separate. They don't interact. And so Schachter and Singer said, well, let's look at this. And also, let's look at the effect of context. How does what's going on around you impact your emotional experience? They did a very clever experiment, one of the classic experiments in all of psychology. So they took a group of participants, and they injected them all with adrenaline, otherwise known as epinephrine. It's part of our fight or flight system. It increases your heart rate, dilates your pupils, increases breathing, and these are noticeable physiological changes. So what happened? Well, half the people, they told, this is adrenaline, you can expect your heart rate to go up. The other half, they didn't tell anything to. Those participants had no idea what to expect. And then they had them do a really boring task. They were filling out paperwork. And here's where the context comes in. Schachter and Singer put the participants either alongside what we call a confederate, someone who's in on the experiment, but the participant thinks is just another participant. And that confederate was either happy to be doing the paperwork, or they were angry. They were mad that they were doing something so boring. And afterwards, Schachter and Singer asked the real participants, those that weren't actors, how they were feeling, what emotion they were experiencing. And here's the really interesting part. The people that were told your heart rate's going to go up because this is adrenaline, the people that were told this didn't have an emotional experience. Their heart rate went up, they were physiologically aroused, but they could explain it. They knew it was just because of the injection. So they didn't have an emotional experience. However, the people that weren't told had their heart rates increase, but couldn't explain it from the injection. They didn't know what the injection was. And so they had an emotional experience. But which emotion they experienced depended on whether they were with the happy confederate or the angry confederate. They were with the happy one, they reported being happy, being excited. If they were with the angry one, they reported being angry. So what does this tell us? Well, it tells us that all the preceding theories didn't quite have it right. If our folk psychology theory had been right, and physiological arousal were only the consequence of an emotional experience, then people would not have been affected emotionally by knowing what was causing their heart rate to go up. If physiological change is just a consequence, then that means we don't monitor our physiology to inform our emotional experience. But obviously we do. People whose heart rate went up had an emotional experience, but only if they couldn't explain it. It also tells us that Cannon-Bard isn't right. There's an interaction between physiological change and emotional experience. So these are interacting parts. It is not that one happens before the other necessarily, but it's also not that they're independent. So our physiology informs our emotional experience, but so does the context. So James Lange isn't right either. It's not that the physiological change drives our emotional experience. If it were, everyone injected with adrenaline would have had the same emotional experience because they would have undergone the same physiological change. So what does this tell us? Well, it means that none of the preceding theories had it quite right because clearly we monitor our physiology. It helps inform our emotional experience. But our emotional experience also depends on the context. We use the stimuli around us to tell us what emotion we are probably experiencing, in addition to listening to our physiological state. And listening to our physiological state is not just part of the Schechter-Singer theory. It's also part of what's called the somatic marker hypothesis. And this is a famous book by a scientist named Tony Damasio called Descartes' Error. And what the somatic marker hypothesis says is that we use our physiological state to inform not just our emotions, but our decisions. And so this is a figure not from your book, but what it says is that physiology differs between people if they've had certain forms of brain damage. So this is a famous experiment where people basically engaged in a gambling task. It was card-based. They were drawing cards, and the cards either had good outcomes or bad outcomes. And there were different decks of cards. And participants could choose which deck to play with. And at first, no one knows which deck to play with. But after a while, normal participants learn that some decks seem to have pretty good payoffs, but every now and again there's a catastrophe where you lose an enormous number of, in this case, points. Normal participants will learn to avoid that deck because of the possibility of this big negative event. Participants who have had damage to their prefrontal cortex don't learn this. They keep choosing from the bad decks, as they're called, because they're insensitive to those big negative events. And what seems to be going on is that people are monitoring their physiological state. When you're about to do something dangerous, you will have a little fight or flight response. Your skin will get clammy. Your heart rate will increase. And so people without brain damage notice this. And the somatic marker hypothesis says that those physiological changes tell us to avoid those decisions, that we listen to our body, in essence, and it informs us what decision to make. People with prefrontal cortex damage can't monitor their own physiology for whatever reason, and they make these bad long-term choices. They are not sensitive to the possibility of big negative events. And so they make bad long-term decisions. And this is true behaviorally. They do make bad long-term decisions. And also, they seem to be less sensitive to their own physiology. So that's the somatic marker hypothesis. And of course, emotional experience is not just internal. We have physiological changes. We also have expressive behaviors. That's one of our three components of emotion. And the question for many years has been whether the emotions and the way we express them are really universal. Does everyone feel the same set of emotions? Does everyone express them the same way? And the answer here is mixed to the question of whether there are universal expressions. If you take the basic emotions, and here we're going to the categorical theory, things like anger, sadness, happiness, fear, you can ask whether everyone experiences them. This depends on self-report. But you can also take pictures of how people express these emotions. And then you can ask different people, what emotion is this person feeling? And in both Western and non-Western societies, if they are sort of literate and if they interact with other cultures, there's a lot of agreement. When you see a picture of an angry person, everyone says that person is angry. Also, in these Western and non-Western cultures, if they're literate, if they have contact with other cultures, there's also a lot of agreement on emotions like surprise and disgust. If you go to isolated cultures, cultures that are non-literate, that haven't had contact with either Western or non-Western cultures, there's agreement on some emotions, especially happiness. Happiness is happiness the world over. Everyone smiles when they're happy, and everyone recognizes a smile as a happy expression. Things like surprise and disgust are less agreed upon. People from isolated tribes in the Amazon, for example, will not necessarily say that what for us is a surprised face, will say that that is surprise. For them, they express surprise differently. And they also would have trouble recognizing surprise and or disgust in someone from a Western culture. So some expressions like happiness, like anger, seem to be pretty universal. Other emotions like surprise and disgust, not as much. So as you move from a Western literate culture to a non-Western literate culture, there's a lot of agreement. But as you move to an isolated tribe, there's less agreement for surprise and disgust, a lot of agreement for happiness, anger, sadness, and fear. And of course, a basic question is, why do we have emotional expressions? What good do they do? Is there a behavior? They don't help us. And we'll get to the fact that they actually do help us a little bit. But intuitively, they don't help us experience our emotions. But there are a couple of reasons why we have emotions in the first place, and why we express them with our faces so much. The second question is actually easier to answer, so I'll go with that one first. We communicate our facial expressions. We communicate what emotions we're expressing. Especially for things like fear, that can be useful to other people. If we're suddenly afraid of something that somebody else can't see, but they can see our face, they know there's potential danger out there. If they see our faces expressing sadness, we may need some help. And our sad expression signals to others that we need help. If we're angry, then that signals to other people that they maybe need to stay away from us, that they should not provoke us further. And so that can be a useful communicative device, these facial expressions. The bigger question is why we have emotions in the first place. And we already know why we have the fight or flight response. It's to respond to a threat. Anger, similarly, seems to be a response to threats, especially social threats. We'll pick anger as an example. Anger may be sort of a shortcut. It may be a program that our nervous systems have evolved to help us express certain behaviors and express them quickly in response to certain stimuli. And it may be a key component that they are largely involuntary, that we can't control them. So somebody who didn't have the emotion of anger, you could do something unfair to them, you could harm them, you could threaten them, and they might sit there and contemplate, well, what should I do about this? They'd sit there for a while, they wouldn't have a very quick response, and they might deliberately, that is, thoughtfully, tell themselves, well, I could respond aggressively to this person, but that could harm me too, and it's really not worth it. So what would happen to a person like that? Well, they would probably be taken advantage of. People would realize that this person isn't going to get angry with them, and they could treat them unfairly. Consider the opposite. Consider the typical person that does get angry. Well, I know not to treat that person unfairly because even though their aggression might harm them too, they may not be able to control it. And so I'll think twice before treating a person poorly if I know they might have this uncontrollable aggressive response. So emotions may be these involuntary shortcut behaviors and experiences that make society more cohesive, make it better for everyone. Now, things can go wrong, to be sure, but the emotional behaviors we experience may help us get along with others, may help us get help from others, may help us not be treated unjustly by others. And so these may be these sort of shortcut programs that are quick, that produce these uncontrollable behaviors, and that other people can respond to and even anticipate. So how do we express emotions? Obviously, we do it with our faces. We have facial muscles underneath our skin, and those are controlled by cranial nerves. We talked at the very beginning of the course about cranial nerves. So they control the muscles underneath our faces, and those move our face in particular ways. And this gets to what's called the facial feedback hypothesis. And this is the idea that We're used to thinking of our emotions as producing a facial expression, but maybe it's a two-way street. Maybe the expression we're wearing has something to do with the emotion we experience. Maybe it causes, or at least indirectly affects, our emotional experience. And there's some evidence for this. So in a classic experiment, some psychologists had participants hold a pencil either above their lip, between their nose and their lip, or hold the pencil between their teeth. And after doing this for a while, they rated their emotion. Interestingly, participants who held the pencil above their lip reported feeling more negative than participants who held the pencil in their teeth. And the idea is that holding the pencil above your lip forces you to frown, while holding the pencil between your teeth forces you to smile. It's not that you're doing it because you feel the emotion of sadness or unhappiness or happiness. You're being told to hold this pencil by the experimenter. Nevertheless, holding that expression for a while seems to impact the emotion you're feeling. This is, to be fair, a very small effect. So this is not a big effect. If you're feeling really down, you are not going to make yourself instantly happy again by holding a pencil between your teeth. Nevertheless, it does seem to be an effect. And interestingly also, with the advent of Botox treatments, which paralyze facial muscles, people of course have them cosmetically to reduce the appearance of wrinkles, but especially if too much is used, there is an impact on people's ability to register their own emotions. They can't detect their own emotions as well. This feedback process seems to be broken or at least inhibited by the Botox treatment. Also interesting is that people that have had Botox treatments have a harder time accurately registering the emotional expressions of others. And this suggests that not only do we look at other people's faces when they're expressing emotion, we also, to some extent, mimic their emotional expression. That helps us interpret it. So if you've had Botox, you can't mimic the facial expression someone else is wearing, and you have a harder time interpreting it. Also, this gets to the idea of evolutionary psychology, the idea that we've evolved these emotional responses and these emotional expressions over many, many generations of our species. So apes, for example, have expressions that are like smiling and laughing that we call a play face. They also have aggressive responses. They exhibit fear responses. A lot of the basic emotions that you and I experience seem to be experienced in other animals, and especially the apes. And for apes, the emotional expressions are pretty similar. So this suggests that emotions are not a uniquely human phenomenon, and that they don't just help people. Other animals seem to have them too, especially the expression part, and that, again, may be a helpful signal to other members of the same species. Looking at the connection to the brain, some early experiments disconnected the cortex from the brainstem and cerebellum. And researchers noticed that when this was done at a particular spot, when a particular amount of the brain was taken away, that the animals, when you handled them, would respond with what we'd call an anger response, a rage response. But it wasn't really based on anything. It wasn't directed at the experimenter in particular, and it wasn't in response to something that would normally make an animal angry. So this was called sham rage. It was a rage response, but it wasn't really a normal rage response. It wasn't real in many senses. And this is also called decorticate rage because it happens after you remove the cortex, after you sever it and disconnect it from the rest of the nervous system. But it depends on where this slice happens. So if a part of the brain called the hypothalamus is still connected to the rest of the nervous system, you get sham rage. If you slice it just a little bit differently, and now you've removed the hypothalamus as well, then you don't get this rage response. So this evolutionarily old structure, and we'll see that it's important for the regulation of hormones in our unit on hormone and sex, This hypothalamus structure seems to be involved in this emotional experience as well. Later on, and this is going to highlight the importance of a part of the brain we call the amygdala, later on, two scientists named Kluver and Busey discovered what's called Kluver-Bucy syndrome. When you remove the temporal lobes, animals become sort of fearless. They no longer respond to the dominant structure in their group. They don't have normal fear responses to things that would normally induce fear. They also, for some reason, we don't know exactly why, will start to eat things or try to eat things they wouldn't normally eat, things that aren't food. And they'll also become hypersexual. They'll engage in sexual behavior with objects or with other members of their species in ways they wouldn't normally. But critically, this seems to involve the removal of the amygdala. So there are these other symptoms, but the main one is a lack of fear response. Also, so this is some early work, we're not going to dwell on this much, but animals will also, it seems, do what's called self-stimulation. If you put an electrode in certain parts of the brain, like the nucleus accumbens, then animals will actually, once they learn that pushing a lever stimulates this part of the brain, they will stimulate that part of the brain over and over again. In some way, it feels good. It is a reinforcer. It is a reward. So it's also true of the ventral tegmental area. These are reward areas. And so we can't be sure, of course, but we suspect that stimulating these areas is highly pleasurable for the animal. And so once it learns the connection between the behavior of pressing the bar and getting the stimulation, it will do so as much as it possibly can. So that's some other work on the brain and emotion in animals. Other work includes fear. So we've not gotten to our unit on learning and memory yet, but we will. And part of that unit is going to be about classical conditioning, where an animal learns the connection between two stimuli out in the world. So if you put a mouse in a cage where the floor becomes electrified, the animal will exhibit what's called freezing behavior. It will stay there in place. And its blood pressure will go up. It will have a fight or flight response. It is afraid of that electric shock. If over and over again you pair the electric shock with a sound, the animal learns to associate the sound with the electric shock. And after a while, after the animal has learned that connection, you can play the sound and the animal will freeze in place, even though there is no shock. So that's what's called a fear conditioning paradigm. We'll talk more about other forms of conditioning in our unit on learning and memory. But that is fear conditioning. And it seems to require this part of the brain called the amygdala. You do not get this form of learning without it. But it's specific to fear. Other forms of conditioning work just fine without the amygdala. And the amygdala is part of a larger set of regions called the limbic system. I'm not going to dwell on this here because there's a lot of debate as to whether the limbic system really deserves that label, whether these are really a network of brain regions that do all the same thing, or whether they just happen to be near each other. So I'm not going to dwell on the term limbic system, but the amygdala and a nearby structure, the hippocampus, which will be, again, very important for learning and memory, they are connected to one another, in addition to other nearby regions like the hypothalamus. So these are all, we're not going to go through all the regions, but they're all connected. They all seem to be involved in our emotional responses. So here we see the hippocampus involved in memory. Here we see the amygdala involved particularly in fear, but in negative emotions and emotions in general. And when it comes to the amygdala is critical for emotional processing, as we'll see. But there are two ways for information to get there, what's called the high road and the low road. And those are sort of funny little colloquial names, but the way this works is very real. So when there's a scary stimulus, that has to get processed at the sensory level, of course. If it's visual, then that information goes through the retina, goes through the thalamus, and the thalamus sends it to two different places. The thalamus sends it on to the cortex, where it can go through in-depth processing, and the cortex can take things like context into account. What am I trying to do? What's around me? Who's around me? What am I doing? What's my goal? But the thalamus also sends information directly to the amygdala. So the high road is the route that goes through cortex. The low road is the route that goes directly to the amygdala. As you imagine, going to cortex, that in-depth processing, takes long. Only after it's done in the cortex is the information then sent to the amygdala. So there are two ways to get to the amygdala. One of them is much faster, and it's the raw data from the thalamus that gets there first. So what does this mean for us? Well, it means you can literally be afraid of something, have a fear response, before you really know what it is. If something has ever jumped out and scared you, you probably have the emotional experience of fear before, for example, you can name or describe what it is that caused the fear reaction. It's also why, if you're watching a scary movie, you can have that big fear response and then calm down pretty quickly. So something jumps out in the movie, you have a fear response because of the low road. All your amygdala knows about it first is this scary monster is right in front of you. But then the cortex gets the information, processes it, and thinks about context. Oh, wait, this isn't real, I'm just watching a scary movie. So then it puts the brakes on the amygdala because it puts things into context. So you have that low road response first, and then later on that high road response, which indicates that you don't need to be afraid of this, it's not real. You can stop the emotional response. So two different ways to the amygdala, but you can have very fast processing that's sort of automatic, and then slower processing that's more deliberate, that takes context into account. And you can actually lose your amygdala. There's a famous patient SM, who due to an illness lost the amygdala on both sides of her brain and no longer feels fear. This is a figure from your book where the researchers had control participants rate how scary some scary movie clips and TV clips were, and they rated them as scary. Patient SM said a couple of them were minimally frightening, and the others were not frightening at all. And this sounds great. Wouldn't it be great not to be afraid of anything? It's gotten patient SM into trouble. She says things that are perhaps socially awkward because she's not afraid of the consequences. Also, she has walked into dangerous situations because she doesn't process them as being dangerous. She's not afraid of them. One famous incident involved SM meeting a mugger, someone who tried to rob her, and she started up a conversation with this person, was not afraid of the mugger. It turned out okay because the mugger was so put off by it that he ran away. But fear can be useful, and the amygdala is certainly useful for recognizing dangerous situations and helping us to avoid them. Interestingly, one thing they could get SM to be afraid of was not getting enough air to breathe. That is an internal physiological state. So when they reduced the oxygen content of the air SM was breathing, she had a fear response. So apparently the amygdala is critical for processing external stimuli, but it's something else entirely that causes fear based on internal physiology. Also, you can have an exaggerated amygdala response. So people with what's called borderline personality disorder, or BPD, if they're shown faces, obviously we have a variety of facial expressions here, but one of them is neutral. The person is not expressing an emotion at all. And patients with BPD have an exaggerated emotional response in the amygdala when there's a fearful face, but even when there's a neutral face. And this is a face that people do not usually have a big response to. It's neutral. It's not expressing an emotion. But the idea is that people with BPD interpret situations and people as threatening, even when the average person would not view them as threatening at all. And this is why individuals with borderline personality disorder may have trouble forming trusting relationships, long-term relationships, friendships, because they have trouble trusting others. They tend to view others as threatening very easily. They will feel hurt by others very easily. They will view behaviors as intentionally hurtful, even when they weren't. So people with BPD have a hard time forming relationships, it seems, because of an exaggerated threat assessment response, and that may depend largely on the amygdala and its response. So the amygdala has these emotional responses, and it's largely the job of the prefrontal cortex to kind of rein them in. Another set of researchers looked at the connection between the prefrontal cortex and the amygdala, and the amygdala also certainly deals with specific fear responses when something jumps out and scares us, but also with a general state of anxiety. And it turns out that the strength of the connection between the prefrontal cortex and the amygdala is correlated with anxiety levels. For people with high levels of anxiety, there's not a strong connection between the prefrontal cortex and the amygdala. People with lower anxiety, that connection is stronger. And the idea is that the prefrontal cortex can sort of put the brakes on the amygdala. And the stronger the connection between the two, the more easily it can inhibit the amygdala and stop those big emotional responses from happening. So the prefrontal cortex is important for inhibiting our emotional responses and controlling them. And if that connection is not very strong, you are more prone to things like anxiety and depression. I'm not going to dwell on this much. Your book mentions it, so I'll go into it. Other portions of the brain that are involved in the emotional response are the orbitofrontal cortices, named because they are above the orbits of your eye. So just above your eye sockets is your orbitofrontal cortex. It's part of the prefrontal cortex. And the cingulate cortex, which wraps around the corpus callosum. It's in the middle of this diagram here from your book. We're about to see more on the cingulate cortex. But the cingulate cortex seems to be involved in things like love, but also things like anger. Orbitofrontal cortex seems to be involved in assessing risk and things like preference. So it's kind of peripherally involved in emotions, but we see it here, so I'll mention it. Also, there's what's called the hemispheric asymmetry hypothesis. And this is the idea that the two halves of the brain are differentially involved in emotions. So if you take someone who's expressing an emotion, like a smile, and you cut the image in half, and then you create two mirror images, one of just the left sides and one of just the right sides of the face, you see here the left sides are more expressive. That smile is bigger. The left side of the face, of course, is controlled by the right side of the brain with that contralateral organization. And this leads us to the idea that the right hemisphere is somehow more involved in emotional expression. There's some evidence to suggest that especially when it comes to negative emotions, sadness, fear, etc., the right hemisphere does do more processing. But we should be a little careful here. This is not a big effect. Obviously, this person can smile with both the left and right sides of their face. And it is not a big imbalance between negative and positive emotions. So do not take this too far and say that people are right-brained or left-brained, depending on how emotional they are. Don't overinterpret. But there are some slight asymmetries in terms of emotional processing, with a little more emotional processing, especially for negative emotions, on the right side of the brain. The brain, of course, is also involved in depression, which is a mood disorder. It affects how people feel in the long term. So if you do functional imaging, if you look at brain activity in depressed participants, there is less activity in this frontmost portion of the cingulate gyrus, right next to the corpus callosum. So you see depressed activity in people with depression. So lower activity in this region. You also see higher activity in this region in average participants when they're thinking about something sad. And so you see this red blob here, same exact region. This is a region that seems to respond not just to sad events, but it does respond to sad events preferentially. Very interesting are genetic influences. So, as we know from our unit on psychoactive drugs, we talked about this briefly, antidepressants, those drugs that alleviate or mitigate the symptoms of depression, work through typically the neurotransmitter serotonin. Not everyone has the same serotonin receptors. And there's a group of people that have different serotonin receptors and tend to exhibit more depression, more anxiety. If you look at the brains of these individuals and compare them to control participants, this same exact region, this part of the cingulate gyrus right next to the corpus callosum in the prefrontal cortex, this region has less volume, it's thinner in people that have these different serotonin receptors. So we think these are all causally linked. People that have these different serotonin receptors have less cortex and may be more prone to depression because this is the region that may rein in responses to negative events. It's the region that is more active in people with depression. So this may be about emotional control and inhibition, but there seems to be a genetic component when it comes to serotonin. Okay, switching gears a little bit to aggression. First things first, what is aggression? Well, it's any behavior that's meant to harm someone. And the most obvious example is physical aggression, violence. But you can also have other forms of aggression, like trying to hurt someone's social status by working behind their back, or stealing from someone when they're not looking. That's all harmful behavior, and it counts as aggression, even though it's not what we usually think of as aggressive behavior. And the biggest risk factor for aggressive behavior is quite simply being male. And here's where what we call the androgens come into play. These are hormones secreted by primarily the testes, the male sex organs. And that is not the only source of androgens, because females have some level of things like testosterone as well, but it is the biggest source. And so androgens seem to have an impact on aggressive behavior. If you take mice and you measure how aggressive they are and then remove the testes and measure again, they are far less aggressive physically after removal of the testes. This isn't true for females. If you remove the ovaries, they are no more aggressive afterwards than they were before. And the fact is that they aren't very aggressive in either case. So it's not simply the fact that you remove something or even specifically remove sex organs. It's really removing the testes, the source of the androgens. And you can see this in the long term. If you remove the testes from males and then artificially inject them with testosterone, the aggressive behavior returns. And it goes away again as soon as you stop injecting the males. So aggressive behavior heavily depends on androgens in most animals, especially during things like mating season. Aggressive behavior tends to go way up if there is a mating season, and that's influenced by testosterone. It's not quite so simple in people. So there are obviously plenty of males that have high testosterone levels but don't exhibit aggressive behavior. There are examples of females exhibiting aggressive behavior even though their testosterone levels are not very high. Also, whether testosterone levels are cause or effect is a little unclear in human beings. So testosterone in people may be more about dominance than about causing aggression, and certainly physical violence. So an interesting study measured male chess players and their testosterone levels. And when they won a match, their testosterone went up. If they lost, it went down. This is obviously not a physical contest. There's no physically aggressive behavior happening here. And arguably, it's not even aggressive at all. You're not really harming the person other than perhaps their standing in the chess ratings. So testosterone in this case seems to be the consequence of winning and losing. After an election, if your candidate wins, your testosterone levels rise. If your candidate loses, they go down. So it's more than just testosterone causes competitive behaviors. It may be the reverse is true as well. Competitive behaviors will lead to changes in testosterone. Also, during puberty, males will experience very high levels of testosterone, but aren't notably more aggressive. Certainly, aggressive behavior is more typical of late adolescence and early adulthood in males, but that isn't that tightly linked to high or low testosterone levels. So we have to take the testosterone equals aggression hypothesis with a certain grain of salt. Okay, moving on to stress. So stress has sort of a circular definition, or at least not a very powerful one. Stress is anything that throws the body out of balance. Well, that just makes you ask, what is balance in this case? Anything your body has to respond to is technically stressful. Now, that's not the way we usually use the word stress. We tend to save the word stress for negative events that have a big impact. But biologically, stress is anything that the body has to respond to, anything that throws it out of balance. And stress does actually have both positive and negative effects, as we'll see. The whole point of the stress response is to let you respond to whatever the stressor is, what's causing the stress, the event. And that stress response has some positive effects. It does actually let you deal with a stressor, and especially if it's threatening, more effectively. We're used to stress being a negative because of its negative effects, especially in the long term. And stress involves the release of hormones, just like aggression does. Now, we've already seen epinephrine, norepinephrine in our unit on neurotransmitters. They're involved in our fight or flight response. They are released very quickly in response to stress. Hormones like cortisol and testosterone are released much more slowly and later. It takes a while. It takes a little bit of stress being experienced for quite a while before we see cortisol and testosterone get involved. The fight or flight response, very quick, takes seconds. Cortisol and testosterone takes much longer. So how do we study this, and what's the history here? Well, an individual named Hans Selye examined the stress response and divided it into stages. This is a figure not from your book, but we see the stages here. We have the alarm reaction, and this is where the body perceives the stress, where it processes the stressful information, and this is the quickest part. This is the first response. You're trying to mobilize resources. You're trying to free up energy. You're trying to make sure the senses are accurate. So you're going into fight or flight mode. Then you have the resistance stage, where you actually have to deal with the stressor. You respond to it with some behavior. And you're either successful or you're not. And especially if you're not, if the stressor doesn't go away, you hit the exhaustion stage. The alarm reaction frees up resources, especially raising your blood sugar. You go through that energy during the resistance stage, but then eventually you run out. And this is where you start to get into trouble with the exhaustion stage. Your body has been highly aroused for a long time now. You have burned through your energy reserves. You start to damage tissue, for example, with prolonged stress, as we'll see. You become susceptible to things like disease and certainly hunger, because you've been ignoring digestion and hunger for a while now. And now your body is exhausted. It's gone through its energy. It's starting to accumulate damage. That's the exhaustion stage. So there's 3 stages in the stress response. So you could actually study this stress response and hormone levels as a person undergoes a chronic stressor. So they took a group of individuals in the military that were learning to skydive. They were paratroopers. And every day they engaged in training, they measured their hormone levels. So they measured cortisol, testosterone, epinephrine, norepinephrine, and growth hormone, which we're not going to dwell on here. But important for this study and hormone levels was how the person dealt with the stressor. So all of these individuals successfully learned to jump with their parachutes, so they were able to cope with the stressor. They learned the skill. They could deal with the event. So on day 1, cortisol levels were high. But after a couple days of practice, they returned to their baseline levels, their normal levels, because the person learned how to do this. They learned how to cope with the stressor. On the first day, testosterone levels were low. This was a challenge. The person wasn't sure whether they could overcome this stressful event. As they learned, testosterone levels returned to normal. Epinephrine and norepinephrine, similar stories. Very high levels on the first day because of the fight or flight response. These levels return to baseline as the person learns how to deal with this, as this becomes normal, as the person realizes that they can deal with this challenge. Again, growth hormone we're not going to dwell on, but elevated levels on day one return to normal afterwards. So the outcome matters. Just like we saw the outcome matters for testosterone, whether you win or lose, whether you're able to overcome the stressor or not, matters for your other hormones as well. And of course, stressors can be complex, and this is pretty unique to humans. So we have a complex social environment. Stress can be socially based. Other people can cause us stress, and cause us stress in the long term. So this is an interesting study when, due to a gas shortage, people started using public transit more. They were able to measure epinephrine levels, and people had higher epinephrine levels when it was crowded. It was more stressful. Also, epinephrine and norepinephrine levels can vary with what I would call self-imposed goals. So things you've sort of volunteered for. Stress is not always something scary jumping out at you. Sometimes it's something you know is coming and you have in fact planned for or even volunteered for. So when an exam is coming up, your fight or flight response will become more and more active. Your norepinephrine and epinephrine levels will increase. This can be measured. Also, those goals you impose on yourself can have a beneficial effect. So exams are stressful pretty universally. No one likes taking exams. But on the flip side, having a long-term goal that's positive in mind can actually increase your odds of survival. As we're about to see, your stress levels have a lot to do with your health. Having a long-term goal in mind, something positive, a sense of purpose, will help you live longer. Whereas not having a sense of purpose, feeling sort of hopeless or pointless, that's stressful. That will have a negative impact on your health and lead to a shorter lifespan. And this brings us to the idea of health psychology. So stress impacts your immune system. It actually suppresses your immune system. If we recall, our fight or flight response inhibits things like hunger, inhibits digestion, inhibits your immune system, because these are all long-term processes. If your fight or flight response is kicked in, it's because you're dealing with something stressful. You need to escape a situation. You need to fight, for example. And so longer-term concerns like disease, like hunger, aren't very important. It's important to deal with the stressor right now. What's unique to humans is that we can have longer-term stressors. Animals don't really have these. And so those long-term stressors suppress the immune system for longer than our ancient ancestors experienced. It starts to affect our health. So the immune system, of course, the immune response, is a big part of our health. It indicates our susceptibility to things like disease, certainly, but also things like cancer. And again, we are able to experience long-term stress in a way that other animals don't. There's a famous book called Why Zebras Don't Get Ulcers by a psychologist and physiologist who studies stress responses. And the idea is that animals have to deal with stress, but it's always short-term stress. It's being chased by a predator or competing for a mate. These are very short-term processes. They end quickly. Whereas humans, because of our complex societies and goals, we can have long-term stress, trying to make it through a class, for example, undergoing financial stress, not knowing where your money is going to come from, having a dissatisfying job. These are all things that animals don't experience, but people do all the time. And so the idea is that the reasons long-term stress is harmful to humans is that it's an exaggerated version of short-term stress, and our short-term stress response is helpful. So when we're in fight or flight mode, we're able to escape that predator or fight off that competitor because we've mobilized energy. Our blood sugar has gone up. Our muscles are ready for action. Our heart rate and blood pressure have increased to get us ready for activity. But if you do that for a long time, it's going to increase your blood pressure for a long time. It's going to harm your cardiovascular system. Long-term effects like growth are not important when you're in fight or flight mode. If you're stressed for the long term, it will inhibit your growth. It will inhibit your reproductive system. You will have reproductive deficits. It will suppress your immune response, as we've already seen. So all of these are just exaggerated versions of things that in the short term are positive. In fight or flight mode, you don't want your body devoting energy to the immune response, to reproduction, to growth. These are all long-term concerns. So the reason we have these negative consequences and the reason we think of stress as a negative is really because of long-term stress. In the short term, our stress response is actually helpful, especially for physical threats. So we can compare what happens in the short term to what happens in the long term. In the long term, we have, for example, the onset of diabetes because of that elevated blood sugar. We have high blood pressure. We have suppression of growth, suppression of reproduction, suppression of motivation, because these are all long-term goals that get suppressed by a system that's only supposed to be active in the short term. But in humans, we can activate it in the long term by subjecting ourselves to complex, stressful environments. And that's really the answer to why do we have this stress response. At the beginning, we talked about why have it. It's unpleasant. It doesn't seem very good to be stressed out for the long term, and it's not. But our stress response is helpful in the short term, and that's why we have it. Okay, that will do it for our unit on emotions, aggression, and stress. So we talked about how we think of emotions, what we think their organization is, what they're good for, why we have them, and also how they connect to the brain, which parts of the brain are important for emotional processing. And of course, we just talked about aggression and stress, and we contrasted a lot of the human experience of these things to the animal experience. For animals, aggression depends, it seems, heavily on things like testosterone. For humans, that relationship is less clear-cut. Stress. Animals tend to experience short-term stress only. Humans have complex societies, complex goals. We experience long-term stress that can have a negative impact on our overall long-term health because of the interaction between our brains, our hormone levels, and our immune systems, for example. We're going to come back to the idea of the brain and its involvement in hormones in our unit on hormones and sex. Okay, so be sure to take the online quiz for this unit, as always, and read the Winston et al. Paper. It should be available now already. So read that paper and be ready for our discussion in class. So that paper is about an emotional judgment. It's about the trustworthiness of faces. So an interesting stimulus, but one we have to deal with a lot, other people's faces. So we'll talk about that in our discussion. And just as a reminder, as we approach the end of the course, remember those writing assignments. Also, remember that discussion is an important part of class. So do read the Winston article. Come to class prepared to discuss it. Volunteer ideas, volunteer alternatives. If you don't understand something about it, be sure to ask. Because again, discussion is very important. So that is the discussion component of the course, and it's a non-trivial part of your grade, so keep that in mind. Okay, with that, I will see you next time.